Freeman. I'm the Memory Center Program Coordinator here at Norton Neuroscience Institute's Memory Center. So I have the honor of working with our team here at Norton Neuroscience Institute, who specialize in diagnosing and then providing ongoing care and treatment for those with memory disorders. And so part of what we do every day is exactly what you're seeing today is just education and information to support the person living with the diagnosis of dementia related disorders, but also the care partners. And really focusing on the community too. So people, we can just keep raising awareness as much as possible. And hopefully you guys can help in that. So anything you learned today, feel free to share with anybody you think could benefit. That's kind of the role that Erin and I, who's on the call today with the Alzheimer's Association, that's the role we kind of want to play today is just making sure we help you through this diagnosis. And just again, sharing that with people in the community because that's how we're going to keep raising awareness of this disease and what support systems are available. And part of getting somebody, or well, raising awareness, I should say, is knowing that this diagnosis, you're not alone, and there are things you can do to treat the symptoms and support you and your loved one throughout the course of this disease. And we're going to walk you through some of that today. So it can be quite overwhelming, very tricky to navigate, not just the emotions, but also navigate yourself through the resources that are out there in the community. If you've been diagnosed with Alzheimer's disease or a related dementia. And so again, we bring this, this is just one of the first of the three-part series called the Capable Caregiving series, where the Alzheimer's Association and the Norton Neuroscience Institute Memory Center will come together and give you guys a virtual educational opportunity and time to engage with us at the end of this presentation too. So our next presentation, I've got to look at my notes here. We have a lot going on. So the next presentation will be next month, and so that will be Thursday, December 11th. And that's going to be creative approaches to difficult behavioral symptoms. So dementia-related behaviors are very common and can be very stressful trying to identify and navigate through those. So we want to give you the tools on how to respond to those things. So Tammy Evano with our Memory Center will be on the call next month with Erin to talk a little bit about that. So without further ado, I'm going to introduce Erin Gilliespie with the Alzheimer's Association to you, a little bit about her role, and then again, just jumping into navigating this diagnosis. And she and I are going to kind of go back and forth with these slides. And feel free to please utilize the chat, or not the chat, but the Q&A. There should be a Q&A button down on your screen where you can submit questions, and Erin and I will get to those throughout the presentation. So want to make this as interactive as possible because we're here just to make sure you feel supported and encouraged through this process. So Erin, as much as you're able, go ahead and take it away.
Well, thank you, Stephanie. And I do apologize for my voice today. I kind of woke up with this. It's like Stephanie and I were talking about earlier. Tis the season. But I'm happy to be here today for another series with Norton Neuroscience Institute. And like she said, I am the director of programs for the Alzheimer's Association. And really, what that means is the care and support lever of our organization. So we strive to not only raise awareness about the disease, but also brain health, but also bring education and support to our communities. So today, I always like to start our presentations out really kind of with a level understanding of what the disease is and how it's impacting our community. I know that this infographic is a little busy, but you can see how important it is for us to be talking about this disease. There's been a lot of stigma around this disease and what it does to families, but the more we talk about it, the safer that we become to talk to our loved ones, but also our providers to get the support and care that we need. This is it shows you how much I'm sorry, the disease is really kind of impacting our communities again. But something that really stands out to me is that it kills more people than breast cancer and prostate cancer combined. And then, just to give you a little background, I've been with the Alzheimer's Association since 2021. I was a caregiver for my grandmother many years ago when I was a young caregiver, which not a lot of people think of. But when I started with the organization, it was almost 6 million people that were affected by the disease. We come out with this facts and figures annually. So the numbers, unfortunately, continue to increase. And so, in 2021, it was almost 6 million, and now it's over 7 million. If that gives you just a little bit of understanding of how much this disease is impacting, again, our community, but also growing. So, just so we all have a little foundation of what the disease is, we are the Alzheimer's Association. So, a lot of people come to us and say, well, do you help people with any kind of dementia? Or I get the question, or someone will say to me, my loved one has Alzheimer's, they don't have dementia. So, just so we have a very fundamental understanding of what dementia and Alzheimer's is dementia is really just an umbrella term of loss of memory or thinking abilities severe enough to interfere with your daily life. The reason you hear Alzheimer's more is because it is 60 to 80% of all cases, so it is the most common dementia. But there are dementias like vascular dementia that can result in from like tiny strokes and blood vessel blockages in the brain. Some experience mixed dementias where there's more than one type of brain changes. And there are some conditions like thyroid issues or vitamin deficiencies that can cause dementia-like symptoms. But that's the reason it's so important to get a diagnosis and the importance of understanding the signs of the disease because some of these can be reversed. It doesn't mean that you have dementia. So making sure that you are going to your provider when you have any signs or, those very small things like you're forgetting your words or your keys, that doesn't always mean that you have memory loss that is going to be forever. And so that's something that we'll be talking about today. And so Alzheimer's it is a progressive disease. So what that means is that it does get worse over time. There is no cure for this disease, but there is a lot of hope in treatment, which Stephanie will talk about a lot here in a few minutes. And we always think about this disease being 65 and older. And while that is true, the majority of people are 65 and older. There are people that are living with the disease earlier in age, and we call that younger onset. And so we think about this being an older disease. But again, making sure you know those signs and symptoms and you're going to your provider with any questions is incredibly important not only for the freedom of knowing what's happening, but also some of the treatments are for only mild cognitive impairment or early stage dementia. So there are some communities that are higher risk than others. One of those is Black Americans are twice as likely as white Americans to receive a dementia diagnosis. Also, Hispanic Americans are 1.5 times as likely, and women are disproportionately affected as well. There's over 11 million women in the world, in the United States, living with dementia or caring for those with dementia. So not only are they more impacted by the disease themselves, but they're also over 60%, or 60% of women are caregivers. And so I'm going to turn it over to Stephanie.
All right.
Oh,
Thanks, Erin.
you want me to play the videos first, I guess.
Oh, sure. Yeah, go ahead.
Sorry, it's taking a minute to
Yeah,
load.
that's okay.
Oh, oh, my apologies. We'll just go with the
All right. Well, you can find those videos. Or can you? I don't know if you can find those online,
absolutely.
Erin. What I like about the videos that she was trying to play, it gives the different perspectives of those living with dementia. So kind of a powerful tool, I think. Um, so Those don't go through.
No,
We'll just
sorry.
touch on, that's okay. We'll just touch on the stages of dementia. So it's one of the most common questions we get, and I think our providers get this question a lot because who doesn't want to know what the future looks like when you've been diagnosed with this disease or disorder like dementia. So I think it's good to know a little bit about what is what is this process? What does this journey look like? And so Alzheimer's disease, as you see on the screen, is a continuum. So we look at it from asymptomatic to the various stages of Alzheimer's disease. So when we say asymptomatic, this is a kind of a diagnosis where somebody might come in and there's no cognitive symptoms, but possible biological changes are happening in the brain. So that means asymptomatic, so not experiencing any symptoms, but maybe you've had some kind of genetic test or something that shows possible biology or pathology. So MCI due to Alzheimer's disease. This is the kind of the earliest stage of cognitive ability or cognitive issues and ability, loss of ability. So mild cognitive impairment, commonly known as MCI. And usually what MCI means, kind of a fluid diagnosis sometimes until you can relate it to its likely Alzheimer's disease. When somebody has memory or thinking changes that may not necessarily be impacting their daily life completely, where they're having loss of function and things of that nature. But it's noticeable, if you will. So we might say, okay, well, this is mild cognitive impairment, and sometimes you can relate those things to vascular issues, or sometimes you'll hear the provider say this is likely due to Alzheimer's disease because of other factors that we've ruled out and things. And we'll go through how we diagnose this in a little bit later. Then you have dementia due to Alzheimer's disease, and we typically break that down into three stages. So mild, moderate, and severe. Um, and so if you look at the mild, so that typically involves symptoms that interfere with daily activities. So we know if memory and thinking changes are not only noticeable, but they're starting to now impact your daily life or your loved one's daily life. And along with some of the other diagnostic criteria, we can say that this is the mild, usually a mild stage of dementia. So moderate stage, you're going to see more noticeable, more pronounced symptoms that interfere with daily life and interfere with daily activities. You're going to start needing more support and become a little bit more dependent on loved ones around you, or maybe needing some community resources to keep yourself functioning as well as possible. Really looking at your independence and autonomy, but also considering those safety risks and things of that nature are usually quite common during the moderate stage. And then the severe stage, that's when symptoms are interfering most with daily activities, and you're more likely needing the help of another person to carry out all of your activities of daily living. So we'll go to the next slide. So just kind of recap. So there are three broad phases. So there's the asymptomatic stage with MCI, mild cognitive impairment due to Alzheimer's disease, and then dementia due to Alzheimer's disease. And again, we usually kind of broadly break those down into mild, moderate, or severe. But I think one of the most important things to note is while symptoms do progress over time, that's what makes up dementia. So dementia means it's a progressive disease. So neurodegenerative is a word you might hear too. So a person will continue to progress and get worse over time. While symptoms do worsen over time for every single person, people progress through the different stages very individualized, if you will. So different rates just as their abilities change. So no two people with Alzheimer's disease look alike. So symptoms of progression are really experienced the same way for each person. So now let's dive in a little bit to how do we even arrive at a diagnosis of cognitive impairment? So If you are getting to a neurologist or your primary care and you're saying, hey, myself or my loved one has memory and thinking issues, a lot of this is a visit should be history taking. So understanding what does your family history look like of anybody who may have had cognitive issues in your family. What do your specific symptoms look like and how have they progressed and how have they kind of presented themselves over time? That's going to be a big chunk of the neurological workup, if you will, or workup for cognitive impairment is just that history taking, that conversation to understand what are those limiting factors that you're noticing. Then they're going to do a neurologic exam. So that's going to just look at your movement and looking at things like rigidity and just your tone of your body and things of that nature. A physical exam as well. Cognitive testing is what we call it kind of bedside testing. It's just a screen, if you will. So the mini mental state exam, known as the MMSE, and the MOCA, which is another quick bedside test that can really bring to light any changes or issues that are in certain domains of your memory or thinking. So whether that's orientation or short-term memory, long-term memories, where they look at delayed recall, things of that nature. If you're having any issues with this just helps aid the diagnostic workup. Just having a score from this alone doesn't necessarily mean you have a dementia. This just helps aid that diagnostic workup. And of course, we're going to do some laboratory testing. And what that means is we're going to do some blood work because we want to know, is there anything going on that could be reversible? Anything that could mimic the signs of dementia, look like dementia. So having metabolic changes or vitamin deficiencies, for example, those things being can really impact a person's cognition and brain health. So we're going to look at those things to try to rule out other causes of memory and thinking issues. Often we're going to do brain imaging. So that's a CT scan or an MRI scan. That's looking for strokes or tumors in the brain or any kind of um, uh, significant atrophy, which means brain shrinkage in certain areas. This is again going to let us know if there's anything that could be causing memory and thinking issues that would not be a dementia, for example. You can't see Alzheimer's or dementia on a CT or an MRI, but what you can see are issues that we know cause memory and thinking issues. So if your brain scan comes back and says, quote, it's normal MRI brain scan, sometimes that kind of confuses people because you're like, well, I'm having memory and thinking issues. How can it be normal? Well, that just means we don't see tumors or strokes or anything like that that's causing memory and thinking issues. That means we're probably going to say this now aligns with a dementia related disorder because we're not finding any other reasons or cause for memory and thinking issues. So I hope that's clear as mud. So again, feel free to throw some questions in there if I need to clarify anything. So the last three on this slide are not necessarily going to be for everybody. You don't need all of these last three things to help firm up a diagnosis. But neuropsychological testing is just another option and something we can do if we can't arrive at that diagnosis within the provider's office. So if we need a specialist like a neuropsychologist to go way in depth on memory and thinking testing to help us look at and build a profile of the strengths and weaknesses of your cognition, they can really dive in deeper to see if it fits a certain profile for a certain related dementia. Or we can do spinal fluid. So this is becoming more prevalent, especially with some new medications that we have where we need to really confirm a diagnosis. Again, not totally necessary because within pretty great accuracy in a neurology setting or your primary care office, just with the other things mentioned, we can arrive at a diagnosis with pretty high certainty of accuracy. Um, but the spinal fluid examination is just one way to look at your body's spinal fluid through spinal fluid collection. And under a microscope and all the laboratory testing, they can say it fits with the certain proteins found fit with a dementia diagnosis or proteins found with those with dementia. An EEG, again, even more, not necessarily super common, but something that we can use too, which looks at the electrical makeup of your brain and see if there's any kind of misfirings and see if that leads to any possible seizure-like activity or something that could be causing memory and thinking issues. So let's move on to the treatments for Alzheimer's disease. So I think it is important to say, once we've done this diagnosis or the diagnostic workup, say we arrive at a Alzheimer's disease related dementia diagnosis. So what do we do about it? And I think this is very important to know because I think there is still a stigma out there of why even get diagnosed because there's nothing you can do about it. The disease is just going to keep getting worse. That is true. However, there are plenty of treatment options out there now, and I'm going to highlight some of those. But more importantly, the support that you and your loved one can get to is just as important, I think, than some of these actual medical treatments. So while there is no cure, there are treatments for that can change the disease progression. So there are drug and non-drug options that can help treat some of these symptoms. Um, so it, again, the disease pathology in the brain is not necessarily well, there's lots of research studies out there trying to find kind of that magic cure. While we don't have that yet, so we'll dive into a little bit more about the drug options that do help treat symptoms, which means memory loss, confusion, and maybe some of those behavioral symptoms. And again, everyone experiences Alzheimer's differently, so treatments do work differently for some people. Not every person is going to have that same effect as the next, but these are available and worth trying, I believe, if your provider agrees. So we'll go to the next slide. Just to dive in a little bit more specifically about what these medications and treatments are. So we first want to talk about cholinesterase inhibitors. So we call these kind of cognitive enhancers, if you will. So the first two bullet points there are going to highlight medications that treat the symptoms. So these are commonly prescribed in somebody who has been diagnosed with a form of dementia. And they work on certain neurotransmitters in the brain that are very important for communication. So you can be on a cholinesterase inhibitor and an NMDA antagonist. So you can be on one or the other or a combination of both. So again, that's a conversation for you and your provider. Next, we have now, within the last 2 years, finally have some FDA approved medications to actually treat and slow the progression the actual disease itself. So the disease pathology of the brain is now being treated by these new anti-amyloid therapies that are FDA approved. So they do not reverse the disease, but they are slowing down the accumulation of the amyloid in the brain, which is the hypothesis of what's causing the memory and thinking changes. So there are two medications, lecanemab or Leqembi being one, and donanemab, Kisunla being the other. So two different disease or two different medications. Both mechanisms are similar, so they're both IV infusions given. One is given every month and one is given twice a month. And so again, very fortunate that after many, many years of not having anything new, we now not only have something that's assisting the disease, and not just the symptoms, but the actual disease process. We also want to treat comorbidities. So if that's applicable to you. So if you have high cholesterol, your diabetes is out of whack, things of that nature, we always want to make sure those things are being well maintained. So you'll have to work with your primary care doctor or your memory specialist just to know exactly what other diseases or diagnoses you have to make sure those are being well maintained because a lot of times if those are out of whack, that can really impact your cognition. Education and caregiver support, doing what you're doing today, educating yourself as much as possible about this disease, and getting the support you need it can be just as impactful, I think, as some medications. Maybe I'm just biased because that's just what we do, Erin, but I think all of our providers would agree in that. So a combination of these medications and these therapeutic interventions are very helpful. Something that's not for everybody, but worth considering is clinical trial participation. So, being at the part of the process of finding new diagnostic mechanisms or treatments, clinical trial participation could be right for some people and worth considering. Again, not for everybody. Then you want to look at cognitive rehabilitation, which is something that our speech language pathologist professionals offer. It's like it's like physical therapy for the brain, if you will. That's overly simplistic, but what I mean by that it is very much they figure out the strengths and weaknesses of your memory and thinking and can implement strategies, cognitive strategies to help support you in that area. Of course, diet, nutrition, we really want to focus on that. Anything that you can eat that's good for the heart, hopefully is going to be impactful for the brain too. Making sure you're eating a well-balanced diet and exercise and social activity. I can't expand on these enough. But the exercise to any degree, especially if there's a social component to it, is really going to be helpful for you as you are diagnosed in your diagnosis and your diagnostic journey. So let's go to the next slide. All right, Erin, you want this one?
Yeah, sure. Getting started, and we really kind of laid the foundation. But now, as a caregiver, a person living with the disease, we know that this is very life-changing. It's also there's some definitely uncertainty when you're thinking about planning for the future. However, it is very critical to begin planning for legal, financial, and care needs. And for the person living with the disease, this can be very empowering because that person now has a say in what happens to them in the future. And they are able to give their voice. And this also can be very helpful for the caregiver to reduce stress. I was in a webinar just yesterday, and one of our educators, she was a caregiver for her grandmother, and said, when she had her mother was in ICU, she was a caregiver. She lived with her for a very long time. But when she was in ICU and it was towards the end of life, that stress of making those big decisions was off her shoulders because she had those previous conversations with her mother. And it was just very important that time that she could spend with her mother wasn't about worrying to make a decision that she didn't know her mother's wishes for. So, again, it's really important, and that's how you can get started. And uh, gathering important documents is important. And this can be carefully existing in legal documents, but also we do definitely say go to legal services if you don't have a lawyer or something in place. But this can also, you know, again, it's very complex and additional assistance is needed. But consider, again, contacting a professional. Stephanie, do you want to take over this one?
Yep, sure can. All right. So identifying as a caregiver. So it seems kind of, I was kind of taken aback when we've built programs like this before of like who really identifies as a caregiver, thinking that was just clear. But actually it's not. So some people think, oh, I'm just a neighbor or I'm not really a caregiver. But if you're running errands to any capacity to help support somebody in their daily life, you can be considered a caregiver. Um, and so it's important to just kind of know what that means and who are these caregivers because I think it's important to know kind of what you are how to identify and so to identify the levels of support that you may need. Okay, so next slide. So how do you prepare for the role of a caregiver? So it's not something that you ever just, necessarily just assume that you're going to be a caregiver at some point in life, or maybe you do. But there are ways you can take control of your role and really live well as a caregiver. Because let's be honest, if you're supporting yourself and taking care of yourself, it really directly impacts the person that you're caring for. But it is quite possible to provide good caregiving with the right help and support, but also important to make sure you're taking care of your own well-being. And so taking care of yourself can lead to a better experience for you and, like I said, the person with dementia. You're going to have more successful outcomes for everybody, especially in the tasks that you're asking of your loved one. If you are just in a better state of mind, or maybe have some tools in your tool bag for how to approach some tricky situations, everybody kind of benefits from that. Next presentation or next slide. Building a support team. This is one of the things that I think as soon as you hear that diagnosis is you should really start working with any within yourself, with your loved ones, to figure out what is that care team, and what is that care team going to look like for you. Um, it's now it's never too early to start building that care team, because you're going to need all the support that you can get. And fortunately, there is a lot of support out there. So it's just trying to find what support is out there. And that's kind of what we're here for, is to help you kind of navigate through some of those things. So the person living with dementia, for example, I'm sorry, and their care partner, that's obviously going to be the core. And so then you're going to stepwise and kind of step backwards and look at, how do we involve our healthcare community? Let's take that a step further. Your friends, family, your work support. That can be just your colleagues at work, but also are there any employee assistance programs that you should consider? Community resources. There we have a wonderful wealth of resources in the community. But again, we want to make sure we're making that clear of what resources are in the community for you. So next slide. So again, the importance of a care team. So if you have that additional layers of support, you can really get more done each day if you think about it. You can stay active in keeping yourself a priority, taking time for yourself. It can really help lower stress. And if we think about our own health and our own comorbidities, um, increased stress is only going to exacerbate some of those things. So utilizing extra layers of support, whether that's within our friends and family or community resources, is really going to be the benefit of having a care team. So think about who you can trust and rely on. And I think a lot of people don't discount anybody. Let me just put it that way, because a lot of people will be honored to support and help you. It's just you have to figure out kind of within yourself of who are those people that you can approach and talk with them about this diagnosis and what you might need. Um, they're a team that kind of changes over time as the disease progresses. Who are those people that are going to be with you throughout those changes? And think about that. So possible team members could include close friends, family members, neighbors. I just gave a talk at a support group at a church the other day, and it's amazing how the church community for this particular family has really come together. So maybe looking within your own faith-based organizations, or any of your social clubs, could be a good way to reach out. So we also want to include your doctor. So does your loved one's physician or advanced practice provider's office, how can they be involved? Do they have other support staff in their office, like a resource center or social workers, to help you navigate and understand what this disease looks like? Volunteers from local organizations, again, the faith community. And let's also think about the online community. We're on here virtually today. I mean, I think that's just kind of something that, this day and age, we have the ability to to be connected to as many things locally and globally as possible that relate to kind of what you're going through each day. So maybe tapping into those things like All's Connected, which Erin can talk about a little bit more, but that's kind of the online support forum with the Alzheimer's Association. Norton Neuroscience Institute has some support groups, online virtual support groups. There's lots of in-person support groups in the community. You've got to find what kind of works for you. Next. All right, so developing your support team. We're going to keep focusing on the support team because this is really important, and it's really we really want you to get creative and thinking about who those people could be for you. Um, so let's also think about the kind of support you need, and being specific about those needs. So think about your day-to-day routine, and say you think, oh, if I had an extra pair of hands to do X, Y, and Z, or things of that nature, write those things down, and you might start seeing a trend or a pattern throughout the day or the week where you might need a little extra assistance, or maybe it's just an outlet to call somebody, on your drive home from work just to vent, just to chat a little bit. Think about who those people are, those roles that can be filled. Maybe somebody's better at financial questions. Maybe there's somebody who's really good online that can search resources for you, things of that nature. And just be very specific when you talk to people who either offer to help or you're asking of help. The more specific you can be, the highly likelihood of getting that help. Uh, you're really going to be more successful at getting that help if you're more specific rather than just vague. Um, and show appreciation, thank them. But also, if somebody's not able to help or it just seems a little uncomfortable for somebody, try not to take it personally. Um, and even though that can be kind of hard to do, but again, there's lots of people out there and creative ways to ask, and never hesitate to call upon people like Erin or myself or anybody else to figure out creative ways to ask for help. So
Okay,
next.
and I can take
Okay.
over taking care of yourself. Thank you, Stephanie. So taking care of yourself, this is really important. I know Stephanie touched on this a little bit earlier about comorbidities. We see that caregivers are not taking care of themselves because they're too busy taking care of their loved one. And so they do suffer. And 60% of caregivers pass away before the person with the diagnosis. So it's kind of like when you're in an airplane, you have to put your mask on before you put someone else's on. But also internally, think about being realistic. Grieve the losses, focus on enjoying the positives. I always say that this disease isn't sunshine and rainbows all the time, but you can get some energy and there's still love and dignity in that person. And so celebrate those small wins. Even if it's not as big as you wanted it to be, it's still a win. So just be realistic with that loved one. Know that you're doing your best. Being here today is one of those things, educating yourself, getting the support that you need. This really does help make a difference in moving forward when you're trying to navigate different situations, behaviors, stress levels. Take care of your health. We'll talk about this here in a few minutes. It is extremely important that you do so. There's a lot of things, there's risk factors. But again, if you aren't taking care of yourself, you can't be the best caregiver that you intend to be. Take a break. Make sure that you're not doing this alone. Again, there are support groups out there, but there's respite services where you can go in and apply, and someone can come into your home, whether that's to go to the grocery, whether that's to take a nap, or go have tea with a friend. Social engagement is still very important to your mental and physical health. So take a break. Make sure you're doing that. And again, get the help you need from your community support. There's many resources out there. I know it can be overwhelming to find which one is the best fit for you, but that's why, Stephanie and I are here today is to help ease those that it's very difficult. So we're trying to ease you into what these community supports look like, but also what's going to be effective for you. So I'm really excited. This just came out in July, the U.S. Pointer Brain Health Recipe. And so this was a self-guided structured lifestyle program. It was two interventions for this clinical trial. And we've always talked about brain health, healthy diet, and we'll talk about some of those 10 here in a few minutes. But whenever you see what the risks are and how you can improve your health to reduce those risks, what does that really look like? We know that physical exercise is helpful. We know that cognitive exercise is helpful, but how helpful is it? And so we have found there was again a structured and a self-guided clinical trial where people did this recipe. So they had 30 to 35 minutes of moderate exercise. They had health monitoring, so regular check-ins about blood pressure, weight, lab results, and then they also adhered to the MIND diet. So it's kind of the Mediterranean diet and the DASH diet combined. You can look that up. And then also the cognitive exercises, working your brain, doing things that are hard. Those can involve puzzles, computer games. And so, what they have found is that whenever someone, even if you are at risk of developing Alzheimer's, so if you're 65 and older, following this recipe actually can reduce your risk. And also, um, in the in the structured lifestyle program, it actually showed to improve their cognitive impairment. So they looked like they were 2 years younger once they went back into the evaluation. So not only can it help reduce your risk, it can also improve your cognition. So, taking charge of your brain, of course, we know that Alzheimer's, 65 and older, is your biggest risk factors. But as you can see, there are being studies done that there are things that we can do for our brain. And it's very important to reduce several of those risk factors to and growing evidence shows that healthy living can lower the risk of cognition, like I spoke about earlier. And then all of our brains are different, but it's never too early or too late. We are starting to talk about brain health at a very early age now. That is our goal, just like we were talking about heart health. Stephanie said it before, what's good for your heart is good for your brain. We have to start talking about that because if you looked at the infographic earlier and you saw those numbers and how much this disease has increased, it's important that we start talking about earlier so we're not where we are today. We talk about the disease, but how can we keep from getting here? So again, these 10 healthy habits, we talk about these specifically. It's like, why these 10? Well, these are the 10 highest risk factors of developing Alzheimer's, but I will just go through a few for the sake of time. But eating right, like I said, it is in a clinical trial. It is proven that the MIND diet does help increase cognition, but also reduce risk. Managing your diabetes. This, again, if your diabetes gets out of control, it's really important and it can affect memory. Maintaining a healthy weight. There's a lot of studies around sleep right now. When I first started the organization, and one of our AAIC's releases is the study of sleep and how it does affect your cognition. And, some things can be helped if you need a sleep pap or something like that, please do that. Go to your doctor. My mom snored terribly and she was always tired during the day. And she finally went and had a sleep study done. Of course, she had sleep apnea and she has a machine and she said she's never felt better. She's clear in the morning, she's well rested. Again, it's just really important for your cognition health, stay active. Being active socially, but also physically is incredibly important. Go out with your friends, have coffee when you can, take a walk around the block when you can. And then, of course, controlling your blood pressure. We know this is extremely important, again, for the health or for your heart and brain linkage.
All
Stephanie.
right. Yeah, and just to echo a little bit about what Erin was saying about, these items that she's mentioning, especially from the Pointer study on those interventions, so healthy eating, movement, all those things. It's not just for the prevention of developing a dementia. This is really impactful also for people who have already received the diagnosis, especially in the mild stages. These are something, this is conversations that our providers are having with people when they have the diagnosis, along with the medications that we can now offer, is maintaining your health, maintaining your physical exercise, health monitoring, nutrition, all those good things, because it is only going to help keep the progression from going for it can slow the progression. Let's just to kind of reframe the words. It can slow the progression. So it's beneficial for you as the care partner in your risk of developing a dementia, but also for the person who's been diagnosed. So just wanted to make sure and echo that again, because that's very important. So again,
No,
part
that's
of
a
that,
great point. I love
yeah,
that. I have had several people in their early stages starting to play a new instrument or learn a
yes.
new language. And you can see that it impacts them. It keeps them busy, but also they're learning new things. And I thank you, Stephanie, for bringing that up. It's
No, it
definitely
is.
impactful for
It
everyone.
is. Yeah. And there's studies out there. It's like there's different programs looking at just those with mild cognitive impairment and how these interventions can be impactful and the rate of developing the diagnosis of Alzheimer's. And so it can only help, I think. So it was important for us to add this into, if you've been diagnosed with a diagnosis of dementia, we had to add this kind of stuff in because A, for the care partner, but also for the person living with the disease, knowing how to maintain your health is critical. So to that, medical care. So this is again to the point for care partners and for the person living with the disease. Making sure you are receiving your regular medical care with your primary care, with any specialist that you're seeing. Sometimes that means finding a memory specific provider. Not necessary, but it certainly could be helpful. When I say memory specific providers, that's those who are physicians or advanced practice providers who specialize. That's all they do day in and day out is working with patients that have cognitive issues through the diagnosis and then through the ongoing treatment plans. So sometimes seeing a specialist can be helpful as well. So consider seeking a memory specific provider if that's necessary. So you can talk with your primary care provider about that. And then prioritizing your mental and physical or your mental and emotional health um, really kind of goes along with, and there's a very large connection between your mental, emotional health and your physical health, I think. So making sure, again, I know we keep talking about caring for yourself and asking for your health. We can't we can't reiterate this enough, but prioritizing your emotional health, whatever that looks like for you, whether that's professional therapy, that's just time away with friends, that's having some downtime for yourself in a special place in your home, whatever that is, find ways to reduce stress and maintain your emotional, mental health and your spiritual health too. All right, next. So legal, financial, and long-term care planning. So again, something that it's not always the fun topics, but it's something that needs to be kind of high priority when you've been diagnosed with a disorder like dementia is do that legal, financial, and long-term care planning. And to do that, you need to kind of partner with your healthcare provider a little bit because you need to know what is this diagnosis and it's progressive in nature. So maybe what does that look like going forward? Because that can help you gather the information that you might need to help you plan. So, reviewing educational resources by talking with your healthcare experts, talking to other people who've been in your shoes or your loved one's shoes. Making sure that means also to either prepare or update your existing documents. And but what I mean by documents, I mean your wills, your living wills, healthcare power of attorney, legal power of attorney, or sorry, financial power of attorney. Um, but also with that, reviewing educational resources to learn about your disease, you need to learn about the care that you will need so you know what are those resources to help you in your day-to-day life? What are those things going to cost? So talking with the experts about the diagnosis and what services could be needed so you can help pay for those things. And so laying that out with an expert can really give you some peace of mind too Um, but more importantly, when you're doing all of this planning with your living wills or your wills and powers of attorney, make sure you're having these conversations regularly with not just your healthcare team, but also your friends and family that are involved with this. Making sure those trusted loved ones, as well as your healthcare providers, as I mentioned, know where your documents are and what are the content of your plans, because it's all part of the journey. That conversation is quite important, and talking with your loved ones about your wishes, especially early on while you're able to still participate in those conversation and decisions. So listed some resources here, because I think as much as you can learn about your diagnosis, not just for your own coping mechanisms and but also for planning such as the legal, financial, and long-term care planning. So you can find awesome resources at alz.org, which is the Alzheimer's Association, the NIH, which is the National Institutes of Health. They have some great resources, and they even have a specific Alzheimer's disease education section on their website too to kind of help you in this journey. So next. All right, let's talk a little bit about safety. So this is something to consider as you're thinking about your loved ones' needs, and as they change over time, safety is likely going to be kind of impacted. Your autonomy, your independence, but also how to manage safety um, for your loved one. So learning about home safety. So consider the diagnosis and what abilities might change as a person progresses through the stages. A home safety assessment is something that can be discussed at your primary care office or your memory provider. And that can be done just with them. They can give you some resources on home safety, but also occupational therapists and physical therapists can team together to do a home safety assessment too. So what that does is they help you anticipate what your needs will be and how to kind of modify your home and your daily tasks to make yourself, again, as independent as possible, but also safe. And so planning for those modifications is important. So that might be the physical environment, but that also could be just modifications in your daily routine. So, for example, if medications are becoming harder to remember, maybe it's just making little notes or making reminders for yourself. Maybe it's setting alarms on your iPhone or your Alexa to make sure those alarms are going off to remind you to take your medications. And a little bit further modification could be one of those pill boxes. There's automated pill boxes, or maybe at some point we need to kind of reassess and see, does somebody actually need to be present in the home to be giving the medications? So those are the kind of things when I mean kind of modify your daily routines it might be necessary. But just again, as you're educating yourself on the disease, don't front load yourself with all this information. Take it in as you can, but these modifications will kind of be stepwise, and so making sure to call upon those resources that you find in your educational process to figure out how to anticipate those needs. And safety on the road. There are plenty of red flags that could be out there that you or your loved one might be noticing in themselves when it comes to driving. If you aren't sure what those are, there are plenty of resources online. The Alzheimer's Association has plenty of driving resources. Um, just noticing the signs, but more importantly, how to have that conversation with somebody about when it's time to give up driving. And also, again, encouraging your healthcare team to be part of that conversation too. So next.
Right. Thank you, Stephanie.
Yep.
And just to add, I know planning for modifications, especially in your home, can be a little daunting, especially financially. And just know that, again, community supports, there are some grants available for that. So think about that as you are getting that evaluation, whether that is a shower chair or modifying your home, your whole bathroom. There are some assistance programs. My Alls journey, this is new. I know some people may think, why do we have an app for someone with the disease or their caregivers? Sometimes you don't know what you're getting from an app, but we did take this to our early stage advisory board, and this is something for the Alzheimer's Association nationwide. This is something that they have requested. And as we dug a little deeper, we know that upon a diagnosis, there's grief, there's questions that sometimes that you don't feel comfortable maybe talking to automatically with your loved ones or your providers. And so this is a safe space. It's called My All's Journey. It's completely free. It's support guidance, and it connects newly diagnosed people with care partners. And it's all in one app. And then also this is designed for the person living with the disease and their care partner in the early stages. And it does provide personalized guidance. It also has trusted resources and local connections. So if you're looking for a local provider or someone to help you with respite, uh, all these things can be found in on this app. And it also connects you with the local Alzheimer's Association, education programs, support groups. But it's also built with input from people living with dementia. So this isn't people outside of this space making this decision of what's going to go on this app. This was completely guided by people that are affected. And so it's just a great in your hands. I have a question. What can I do about this? And again, it is safe, and you don't have to worry about confidentiality. Everything is confidential and can be very helpful as you navigate this disease. So the Alzheimer's Association also has a lot of information for the person living with the disease. What to expect? Oftentimes that is the biggest question. What does my future hold? What can I look to? What differences can I see in different stages? What assistance am I going to need? And so again, this is on our website, and it's I have alls. And also taking care of yourself. What are those small things that I can still do and that I can have the conversation with my care partner of what my ability is and what I can still do in the different stages of this disease? Also, sharing the diagnosis. We see this a lot. Especially when you first have the diagnosis, you're still going through all the questions in your head and trying to find those answers, and it can be very overwhelming. Again, there's a lot of grief with it, but how do I talk to my family about it? There is a stigma, like I was talking about earlier about this disease, and you hear dementia and you feel like, oh, well, people automatically think of like the severe stage or the middle stage, but it's not always the case. You can still do your daily living and the things that you do on um, on a regular basis, but you might need some assistance in certain small things at the very beginning, and having those conversations, but also how to share your story with your loved ones and the diagnosis can help ease their stress and yours as well, because people know what to expect. And then reducing your stress. There's a lot of anger, stress, and things that go along with this disease diagnosis. So that's very important that you also, person living with the disease, is reducing their stress with social engagement, like we talked about earlier, exercise. And of course, we do have the caregiver support. What does it look like on the caregiver end? What should the caregiver expect as they're navigating this disease through the different stages? Where can I get support? What does those community supports look like that me and Stephanie have been talking about a lot today? And I'll kind of, here in a couple slides, I think I'll show you a really good resource to find different community supports, all by zip code. Daily care. What does that daily care look like? Really supporting the independence of your loved one and still providing them the dignity to do what they can. But what does that look like? And then care options and planning. This slide, another really busy slide by the Alzheimer's Association. But I'm just going to pick out a few. We talked about All's Connected earlier. It's really important to have that social support as well. Who can I go to talk about things that, and people get it? And as you guys know, not caregiving isn't 9 to 5, and sometimes your day is very busy. So, it might be 10 o'clock at night when you have a question or you want to talk with somebody. And so you can get on Oz Connected. It's completely free and it's designed for people living with the disease as well as their caregivers. Our 24/7 helpline, we have so many people that come to us, and this has been their saving grace. We, again, caregiving is not 9 to 5. We even have a volunteer that does all our data entry because she got engaged with the organization really through the helpline because her mother had a lot of issues at night and she knew that she could call this number no matter what. And so you can call this number again. It is staffed by master level clinicians and has information in over 200 languages. But you hear a 1-800 number and you're like, who am I going to talk to? This is our organization. It is not housed out to a third party. And you can call this number whether you need to find in-home care or you need to talk to somebody because you've just really had a really bad day and you don't know where to go next. Or if your loved one is wandering at night and you have tried different tips and strategies, but nothing's working, you can call this number. And as Stephanie was talking about earlier, driving is definitely a point of contention with a lot of our families. And there's a lot of great resources on how to have those conversations, but also tips and strategies on managing them not driving. So again, this number is definitely a go-to. Keep it on your refrigerator, write it down. It's just really important that you have someone at your fingertips you can talk to 24/7, and this is it. And then finally, All's Navigator. It is a great resource for action plans. A lot of times, within this disease and after a diagnosis, and as you're shuffling through the different stages or different issues that may come along as you navigate the disease, is what's my plan? What are the boxes I need to check? What's my next action step? And so All's Navigator really is unique to your inputs. So it is online, but you answer questions that are geared to what you're dealing with today. So it's not broad information, it's very specific to your needs. And that it does give you, after you answer a few questions, and there's different topics like driving, talking to your doctor, talking to your family, legal and financial planning, safety. And so once you answer a few questions of your personal, what you're going through personally, that it does make a care related action plan for you. So that's just a great little tool to have. And then once you have that in hand, then you can start seeking the resources that can help you complete those steps. We've already went through a lot of this, the 24/7 helpline. Again, I can't express how important and helpful this is. It's completely free. And I did mean to mention that within this 24/7 helpline, there is called a care consultation. So it is 1 hour completely free. It's a consultation through our master level clinicians of, you talk about what your needs are, what you're going through today, the challenges, and they really help you devise a care plan, what to do next, who to reach out to. And so this has been really helpful for a lot of people because, like I said, at the very beginning of this disease, upon a diagnosis, there's a lot of questions. There's a lot of boxes to check, but as Stephanie said, you don't need to front load everything, just what you're dealing with today. And it can be very overwhelming. So make sure that you are reaching out to the helpline if you have any of those questions. And again, that consultation is completely free, and you can do it more than once if you have different situations at different times. We do offer free education and support groups. The Alzheimer's Association, Greater Kentucky and Southern Indiana, does provide, we have 125 counties throughout Kentucky and Southern Indiana. We offer in-person education programs, and that's anywhere from the high level of what is Alzheimer's. I think that's very fundamental to understand what understanding Alzheimer's and related dementias, what it does to the brain, to really understand how to communicate and some of those behaviors that come with the disease. And we go from anywhere from the fundamental information of what the disease is all the way down into our empowered caregiver, where we really dig into those communication strategies or the behaviors. Why does this person have this behavior and how to, because some of them can be challenging. Some of them can look totally different than what you're used to in that person before their diagnosis. And what does that look like? And that does, we know statistically, the more education you have, the less stress that you will have because you understand some of those behaviors and you can kind of navigate that. So I do encourage you, you're doing the first step today, coming to this education program, and I do encourage you to come to the other two this winter. And then just know that these education programs, and I know Norton as well has education programs online that are on demand. Again, we know it's important to have resources at your fingertips all the time, 24/7. And so all of our education programs are also on demand and you can view those virtually. And then again, our support groups, and Norton as well has support groups. I always call it an education program as well. No, it's not. It doesn't have curriculum, right? It doesn't have a PowerPoint like we're doing today. But you learn so much from that person sitting beside you that may have dealt with that a certain issue that maybe you're dealing with today, and something worked for them, and then you can try it out, or they used this resource or this physical therapist, and it was really helpful for them. And so, really, you're also creating a community. And I think that's the most important about our support groups. A lot of times they kind of get a negative vibe of like, oh, well, I'm going to have to go tell my story and people are going to be crying. That is not the intention of a support group. It's really about gathering those resources, being able to talk with people that get it, but also creating a community. We know that this disease can be very isolating, unfortunately, and some of your close friends may come around as much as they used to because they don't maybe know how to deal with the disease or you as a caregiver. And so being around people that get it is incredibly important. And we have people that go out to coffee afterwards. They have dinner or lunch dates. And so you're getting friends outside of that support group too that you can really lean on. So again, I do encourage you to take advantage of both of those. And then also trial match. This is how we are where we are today, with the treatments that uh, Stephanie was just talking about. I'm sorry. Thank you for bearing with me today, by the way. Stephanie was just talking about some of these new advancements in treatment, and we would not have that without people in clinical trials. We know that what we're doing today is hopeful. There is a cure out there. But if you're ever interested in being part of the change in the future, I do encourage you to go to Trial Match. It can link you with different trials across the country. Right here in Kentucky, there's a lot of clinical trials going on, and they do need people that aren't necessarily diagnosed. There's a lot of clinical trials about brain health right now as well. So it's not all about people that are actually suffering from the disease. Nope. So I'm gonna stop sharing.
Awesome.